Okay, so this is a video breakdown for knee cars. And what you're gonna find as we go through these and you get used to them is that knee tends to be a lot like elbow, ankle tends to be a lot like wrist. Kind of makes sense if you know anatomy and just the way the joints work. So again, with the knee, we tend to get a lot of flexion extension in our everyday life. And if you're sort of missing flexion extension, unless there's a true joint problem, you can't lock your knee out all the way, you would probably know that because you'd be limping around. As far as flexion extension stuff and different angles, it's going to be a lot of soft tissue, hamstrings, hip flexors, stuff like that. What we're looking at today a lot is rotationally. So most people are kind of unaware that their knee is supposed to rotate. So I actually kind of have a pronounced tibial head here. I don't know if it'll show up on camera because I'm very, very pale, but you can see right here, my tibia is actually rotating. So my entire tib fib is actually rotating independent of any motion of the upper leg. My foot is actually going along for the ride, but I'm not moving through the ankle right now. I'm just rotating through here. And that's what we really want to focus on when we're doing our knee cars. Just quick tip anatomically, if your leg is locked out, the tib fib won't rotate. It can't. So if you're all the way locked out, motion's either coming from the hip or from the ankle. It's not designed to do that. So when we do our knee cars, we don't go to full extension. Couple different positions to do these in. Sitting down is pretty easy. You can do them standing up. If you want to lock them down, you can self-block by putting your leg in a little headlock here. Today I'm just going to sort of hold so you can see. What I want to do is pull into inversion as much as I can and just making sure that I'm getting a lot, or internal rotation, getting a lot of that rotation to the tibia and not just moving my ankle. Right? Again, okay for the ankle to be a little bit of expressive, but I want to see that rotation coming from here, from the tibial head. Once I'm all the way internally rotated, I'm going to ride that ability to rotate as I extend the leg. Now, if you have the flexibility in this position to extend all the way, don't, because again, we don't want to lock out that leg and block out the rotation. So at the top, I'm going to externally rotate. Again, just looking at here will give you a good idea. Am I getting that rotation? Scraping it back. Rotate and extend, rotate and flex. And I'm really just trying to rotate as much as I can as I extend and as much as I can as I flex. Then I'll go back the other way, thinking of kicking the soccer ball, rotate and scraping back in. Really just trying to rotate that knee as much as I can and making sure I'm not getting anything from the hip or working too much from the ankle. So if you just want to do a little self-assessment here, you can get in what we call combat base position. Hold the top of the knee so this is not coming from the hip, and we're just watching that knee rotate back and forth. You should have at least a little bit of motion in both directions. If you've had a lot of hip problems as far as mobility wise, your hips don't rotate in one direction, you're gonna see that probably mirrored in your tibia. For example, if you're always internally rotated, if your knees tend to collapse in while you're doing squats and you have a hard time externally rotating, you're probably going to have a hard time internally rotating your tibia because it's never really had to do it very much in that position. So that's something that we want to really look at as we start to unwind all of the mobility issues. Once we fix your hips, you might find some tension points in the knee that we want to address as well. Joint can be addressed the same way we do anything else: pails and rails, hovers, lift offs, all those fun things. Go Cubs.